Hi, my name is Alyssa Reeves. I'm in Section 4. I'm going to be demonstrating administering IV via piggyback. So the first thing we're going to do is check the doctor's orders. We have on our doctor's order 1 gram over 30 minutes every 12 hours for the antibiotic Rocephin for our patient's infection. So when I go to my meds, what I'm going to do is I'm going to first check the expiration date on my bottle. It's good. I'm going to see that I have in my bottle 500 milligrams per milliliter, and that means I would need to draw up for 1 gram of medication 2 milliliters. So I'm going to go ahead and do my hand hygiene. I'm going to clean off the top of my bottle if it's a used bottle. Going to draw up 2 milliliters of air, inject it into the bottle, and draw up 2 milliliters of medication. Next thing I'm going to do is inject my medication into the mini bag. So I'm going to go. I'm going to place this needle into the sharps container and mix up my medicine. I'm going to label the back of the bag with my client's name, my initials, the date, the time, the medication, and the dose. Now I'm going to label my tubing with my initials, the date, and the time, and I'm going to attach it to my mini bag, maintaining sterility. I'm going to fill up my drop chamber about halfway. And I'm going to prime my tubing. Okay, I'm going to re-clamp it. And now I'm ready to go into my patient's room. So I'm going to bring my medicine with me into the patient's room, my bag, my tubing, gloves, and the hanger. I'm going to knock on the patient's door, knock, knock, knock. Introduce myself. Hi, my name is Alyssa. I'm going to be your nurse today. The doctor's ordered 1 gram of Rocephin for you. It's an antibiotic to help fight off your infection. So I'm also, before I get started, I'm going to check 2 identifiers on your wristband, your name and your birth date. Okay, good. I'm going to go ahead and check his IV site as I'm washing my hands for any phlebitis or infiltration. I'm going to make sure my hands are clean. I'm going to put on my gloves. I'm going to go ahead and make sure this is clamped, hang it. I'm going to go ahead and take a port that is underneath the clamp on the primary tubing. I'm going to clean it. And attach my secondary tubing. And then I'm going to clamp off his primary. And go ahead, and I'm going to go ahead and lower this bag. Okay, now I'm going to start unclamping the secondary tubing and establish my drop factor by counting for 30 seconds. My tubing has a drop factor of 10, so my drops per minute will be 17. Okay, now that the medication is running, I'm going to go ahead and make sure my patient is comfortable. I'm going to check. I'm going to make sure he doesn't have to use the restroom. I'm going to assess his pain levels. I'm going to make sure his collate's within reach, that his bed is lowered, and all his possessions are where he can reach them. And then I'm going to come back. I'm going to periodically check on you and come back in 30 minutes when the medication is done administering. So 30 minutes later, I'm going to knock on the patient's door. Hi, it's me again. I'm going to go ahead and check your wristband, your identifiers, name and date of birth. So your medication is done administering. So I'm going to wash my hands and put on my gloves again. And then I'm going to clamp off his tubing for the secondary line. I'm going to unclamp the main tubing and establish the flow rate for this tubing as well. I'm going to unattach the secondary tubing, putting a sterile alligator clamp back onto the secondary tubing, and I'm just going to hang it because it's good for the next 24 hours. I'm going to double check the date on this tubing, and I'm going to go ahead and check my patient's position. I'm going to check my patient's position, the IV site, the pain level, the personal belongings are within reach, and if he has to use the restroom. And then when I leave the room, I'm going to document the time the drug was given, the type of drug, the dose, the route, the condition of the patient's IV site, and I'm going to record the medication into the intake and output. Thank you.